Let me introduce Dr. Marleen Meyers. Dr. Meyers runs our survivorship program. Survivorship is a big entity. In 2020, we're going to have 20 million cancer survivors, and by 2050, there are going to be more cancer survivors than people diagnosed with cancer. It's an amazing not problem to have. But about 75% of people who are cancer survivors are going to have medical issues. And so Dr. Meyers is going to talk about that. Dr. Meyers graduated from NYU Medical School and was a fellow at Memorial Sloan Kettering. She came back to us at NYU. She is she is a member of the AOA Society, which is, that's like the highest honor you can have in medical school. So that's really quite an honor. I say it's the absolute outstanding ally that I have at the Cancer Center. She's a few doors down, and anytime I have a problem or a question, I shout out, Marleen, come over here, I need your help. So it's great to have people from all different disciplines just down the hall from you. And I think that that's one of the benefits of working at a cancer center. So Dr. Meyers, please step up.
Thank you so much, Deborah, for that beautiful introduction, and you make me blush every time. And I feel the same way as you know. Dr. Axelrod is an extremely outstanding, unbelievable breast surgeon, very famous also, and it's really a great pleasure to be able to work with her. So I'm really excited to be here this evening, and I love that the title of tonight is The Faces of Cancer, because that's really what survivorship is about. It's about the different faces. And my first foray into survivorship was actually unbeknownst to me back in the early 1970s when I was a freshman at college at NYU. And I saw an ad that to come to a seminar given by a leukemia survivor. And there were as you can imagine, in the early 1970s, there were actually very few leukemia survivors. I thought this was interesting, so I dragged myself to Silver Towers, to somebody's apartment, and there were a few of us there, and it turns out that the gentleman who spoke was not only a leukemia survivor, but he was also a poet. And he spoke incredibly eloquently about what life meant to him, and I'll never forget, this is going back so many years, but I'll never forget one of the poems he recited in which he said, "Take off your shoes if you must get glass in your feet, but take off your shoes." And the point of that was to encourage people to live their life after cancer. And if we go back to the early 1970s, survivorship wasn't a real entity because, as I mentioned, there weren't many survivors. There were probably under 3 million survivors in this country, and as Dr. Axelrod mentioned, we're nearing 20 million, so there's been really a dramatic change. But with survivorship, as many of you know, come long-lasting problems. Survivorship means getting cancer from the date of diagnosis onward. But even after you've had your treatment, even after you've completed treatment, even after you feel generally well, many of these issues continue. So even though cancer itself ends, the experience unfortunately keeps on. So that's where survivorship comes in. What we want to do is to encourage people and to help people to live really well, to live to the best of their potential, to live in a way that's important and meaningful to them. And our survivorship program tries very hard to do that. We offer lots of programs for people in terms of physical activity, nutritional activity, psychosocial support, and we're very encouraging of people living as well as they possibly can and really getting what's important to them. So I hope that any of you who are survivors, again, meaning from the date of diagnosis, reach out to your doctors, to your nurses and nurse practitioners if you have any issues or questions, because you don't necessarily have to live with the side effects. And there is a lot that can be done nowadays. Dr. Axelrod and myself are very honored to have tonight's speakers because as much as we can be up here and talk to you about all of these issues, there's nothing like hearing from these very incredibly brave, giving people who are going to talk about their personal experiences, because without the knowledge of our patients, we really have nothing. So please join me in welcoming our speakers. I think Dr. Axelrod is going to introduce each one. And enjoy the evening, and please ask any questions at the end if you have them. Thank you.